1 month after mpox vaccines arrived in the Democratic Republic of Congo, authorities are finally ready to put their plans into action. Speaking ahead of the vaccination campaign, the country's health ministry said teams will hit the ground running in the densely populated city of Goma in the east before expanding to other areas in the region.
Once a campaign is launched, we will immediately bring the doses to South Kivu, as it is the most affected province. Therefore, we will prioritize vaccinating adults first, as the vaccine we have received is already approved for adult use.
Goma is home to some 2 million residents and a shelter for thousands of refugees. Aid organizations have warned that displaced populations living in crowded conditions with limited hygiene facilities are especially at risk of contracting mpox. The government hopes to curb the spread by inoculating high-risk communities, but several challenges stand in the way.
There are areas that are very difficult to reach, such as those under occupational camps with displaced people. These present additional challenges, particularly security issues that are also very important to address. And why did we delay by 3 days? Well, there was training that needed to be done and the micro-planning to get as close as possible to the people we need to reach. Of course, there's also community communication, where we must raise awareness among as many people as possible so that those in contact with patients do not take unnecessary risks.
The DRC has reported mpox cases in almost all its provinces. Since the start of the year, the outbreak has infected nearly 31,000 people. Many hope that the vaccination drive, along with community outreach efforts, will be instrumental in curbing the spread of the disease. Muturi Kaibere, CGTN.
Chris Chamringa is in Kinshasa with an update on this. Chris, has mpox vaccination kicked off, and which areas are now being attended?
So according to health officials we've spoken to, it hasn't begun. They're expecting it to kick off in about an hour or so. We've been told that the DRC health minister traveled from Kinshasa to the city of Goma, and so the officials there are waiting for him to launch this mpox vaccination campaign. Now this city, like the reporter there said, is hosting thousands of people who have been displaced by conflict. Many of them are living in crowded camps where cases of mpox have been circulating, and the particular strain is this new one known as Clade 1, which was discovered in South Kivu earlier. It's said to be more contagious. So health workers are really doubling down on trying to ensure that they roll out this vaccine in this area to stamp out this disease. They are counting on the people to come up and get the shots. It's not a mass vaccination exercise. They're targeting 3 categories of people. There are health workers who will get the first shots, and then there will be park rangers, and later on they'll go to commercial sex workers. So they're hoping that this tool they have will really help scale back this outbreak that has killed about 1,000 people since the beginning of this year in the DRC. Penina?
Okay, so Chris, how long is this mpox vaccination drive expected to take, and which are some of the challenges to the process?
Yeah, so it's supposed to take 10 days, but a health official I spoke to from the World Health Organization said it might take longer because of the logistical problems in the east and other parts of the DRC. The road network is very poor in South Kivu province and even North Kivu province, and so they will really have to deploy the vaccines, take some time to deploy the vaccines, the cold storage facilities. DRC, most of the remote areas of DRC has very unreliable electricity, so they will have to put in place generators to ensure that these vaccines that are supposed to be stored in very cold areas constantly have a power supply. And then there's also the issue of insecurity. You know, the east of the DRC, North Kivu in particular, has seen an increase in violence since 2021 after the M23 rebels started launching attacks against the Congolese army. And so there has been a number of armed groups, local armed groups, Mai, that have all come together to fight with the Congolese government against the rebels. So some of these people are very indisciplined. There have been a number of cases of rape, robberies in Goma city. And so that is also a challenge that health workers are really going to be grappling with as they go around trying to vaccinate people. But they have said that they're working with the military governor of the area, and they hope that they believe that this operation will go smoothly. After Goma, they're supposed to go to South Kivu province, and then they will roll it out in other parts like Equateur, Chopo province, and later on come to Kinshasa, which has also recorded a number of cases. Penina?